My name's Caroline. I'm 37 years old. I have two children. My oldest is 13. My youngest is 5. I live here in Charlotte. I decided to have breast augmentation surgery because after my first child was born, I pretty much lost all the mass in my breast. All the tissue was gone. I went from having breasts to having udders almost overnight. And so, you know, and working out as much as I do and being as concerned as I am about my physical appearance, you know, there was just nothing I could do to make my boobs any better. So breast augmentation was pretty much the only alternative. If I wanted to fix them, then that was the route that I was going to have to go. I chose Dr. Didashine after sitting and having consultations with 4 other doctors here in Charlotte, 4 prominent doctors. When I met Dr. Didashine, I immediately felt a connection to him. I immediately felt comfortable. He seemed more like an artist than a surgeon. He had so much input, so much advice to give me. It wasn't like walking into a doctor's office and him saying or her saying, okay, you know, do you want a C or a B? Or, you know, he had some real input. And there were many options as far as, you know, what procedure he was going to use exactly, from what, you know, the implants to the incisions to, you know, the kind of medication. There were several options. It wasn't just one route. He offers a lot. And he's very comfortable, and he's just a very comfortable man to be around. And that's important when you're thinking about having something like breast augmentation. You need to feel that comfort level and that confidence that the doctor is going to do what you want. I opted to take pain medication, so I did all right. Now, I will go ahead and tell you that I had the surgery on a Thursday morning, and I was back at work Tuesday morning. So the recovery itself is just days. And I think that the procedure that I had is a little more complicated than some of the other, you know, a simpler procedure, because not only did I have the breast augmentation, I also had a breast lift. So that's, you know, 2 surgeries in one, and the incision, there's, you know, more of an incision and so forth. So, I mean, that being as complicated as it was, I mean, I was back at work in 4 days. I feel great. As a matter of fact, I am happier than I thought I would be. My husband is ecstatic. My 5-year-old's noticed, and, you know, of course, because my husband's so excited about it, my son gets excited about it too. My daughter, I have a 13-year-old daughter who just couldn't be more pleased. You know, she's always making comments about my overall figure. You know, I don't have a little boy body anymore. I actually look like I'm a woman. As far as the recovery is concerned, you know, I know that Deborah calls. She'll call you every day for a week. Just, you know, Dr. Didashine calls you for, you know, the first couple days as well. So they really do a lot to touch base with you for the week after your surgery to make sure everything's going okay. I think my husband, you know, another thing that I know, my husband loves the fact that I have, you know, I'm secure. I'm more confident. And this is just a funny story. You know, I mean, walking around the house naked is not something that I'm accustomed to doing. But he came home, it's probably a couple months after the surgery, and I was walking around the bedroom with no shirt on. And to him, you know, he loved that. He said that he'd never seen me walk around like that before, and it was neat to see me have the confidence to do something like that, whereas before, you know, I never would have. And that wasn't ever even a conscious thought that, you know, I wouldn't have even realized it had he not pointed it out. So yeah, I'm definitely happier about my surgery than I even imagined that I ever imagined that I'd be. So. His new facility here in Blakeney is incredible. It's a beautiful area. It's a beautiful office. It's very comfortable, and it doesn't feel sterile. And you know, I'd talk to one doctor in particular. You know, you go in and you feel like you're at a hospital, and it's a very sterile, cold environment, whereas it's very warm and inviting here. My expectations were, you know, just to have my boobs where they're supposed to be. But they were far exceeded. One thing, you know, that didn't really come into play till after the fact were the way all clothes fit me. I mean, there were so many things that I just couldn't wear before because I just didn't have the chest to make it look nice. Now I do, and so like my wardrobe is expanded because I can wear anything and look good in it now.